After we do the planning, now we need to do the procedure. In this case, we're going to use the femto laser to create the flap. Here we have the interface, and we're going to proceed in something that has little tricks. So it's very important that you enjoy the 360 experience. Why? Because of this. First, you have the patient. You need to talk to the patient, and you need to have it in the correct position with this joystick. This joystick is gonna, control the bed and the head of the patient. So right here, your objective is to have a centered eye, and you have the red light that's gonna be in the center of the eye. Then we're gonna put the interface, we're gonna do the suction, and then we're gonna keep controlling the distances with another joystick that we can have here, and we can move. There is another thing that we have two pedals. One that is for suction, and the other one is for the laser. Remember that the laser has a protection. That's very important. So Andres, we want you to follow up from us and give us all the tricks and tips to do an excellent procedure.
Absolutely, Ivo. Remember, guys, this is a very crucial part of the surgery. We need to be very careful with the details. We have to speak with our patient. We have to communicate the feelings that the patient is going to feel at this important moment. So now you will see how Ivo will move on with the step of the surgery using the interface, connecting the eye of the patient with the Femto-LASIK.
Excellent. So first, remember, I'm going to put the eye in the center of my field with the right light in the toppest part of the cornea. We are correct there. And now we're going to give our assistant the interface, and we're going to center, okay, to do the suction. Here we are, we're completely centered, and we're going to press the right pedal to do the suction, and we can see that it's in green, and it's done perfect. And now we have an important part. Tell us, Andres.
Yes, now you have the green light, so you can move on with the surgery. You can do the suction, right? In order to then the laser make the job.
Perfect.
Excellent. Perfect. Now you're ready to move on, Ivo. Excellent. The centration, it's great. Excellent. Excellent, guys. This moment is very important because it's the coupling.
And it's not easy.
Exactly.
Right? You need to.
It's not easy. Sometimes you need to try many different times, because the coupling is when you use exactly the interface with the eye of the cornea of the patient.
Tell us the tips in this specific moment when,
Well, one of the most important tips is to tell to the patient, please don't move, because if the eye of the patient is moving all the time, it's going to be hard to get the perfect coupling. Remember, if you get this with a decenter suction, your flap is going to be the center.
No.
I think you got it, Ivo. Excellent.
Okay.
Perfect. Now the flap that we just planned with Ivo, it's almost done.
No, pero no lo hace. There you go.
It's coming, perfect. Now, Ivo, you can see how the laser is working, and can you see the perfect centration of your flap? Excellent.
Perfect.
Done. Excellent. Perfect. We have a beautiful flap with a superior hinge. So next step will be doing the ablation in this patient.
So let's go back to the procedure. And guys, if you're doing your first procedures, you need to understand this. First, you're gonna manage the bed and the head of the patient with one joystick. The second thing is to correctly put the interface, center in the eye, and use your other hand to do the cupping perfectly. And then here, Andres, I think it's something very important to talk to the patient and say, the 50% of the procedure is done, relax, the bed is going to move to the next part of the procedure.
Absolutely. The easier part, it's coming. So this is the most dangerous, we can say, part, because if we have a problem with the flap, it's going to be complicated for us. So now, please relax, don't move, and in a few minutes, you will be out with your surgery done.
Perfect. Thank you very much, Andres.
Thank you, my friend.